Welcome to EAC Speaks, the podcast where we dive deep into the movement to end the HIV epidemic right here in the heart of the South, Arkansas. I'm your host, Eddie Wiley, and together we're going to explore the stories, insights, and passion that fuels engaging Arkansas community's mission. Join us on this journey as we unite voices and take meaningful steps toward a world free of HIV stigma. Now, get ready for a conversation that matters. This is EAC Speaks. Hello out there in podcast land, and welcome to EAC Speaks, the show where we dive into important topics that matter to you. I'm your host, Eddie, and today we're focusing on a significant event that touches the lives of millions, National HIV Testing Day. Each year on June 27th, we observe National HIV Testing Day, which is a crucial initiative dedicated to raising awareness about HIV and encouraging people to get tested. On today's episode, we're going to explore the importance of HIV testing, advancements in testing technology, as well as some resources available for those seeking support and information. Today, we're going to hear from EAC's own Angel, who advocates for widespread testing and education. So, hey there, Angel, can you tell the listeners a little bit about yourself?
Well, hello, listeners. I'm super excited to be a part of EAC Speaks. This has been an exciting thing that I got the opportunity to be a part of. So I am Angel Camper. I'm the Health Specialist Program Coordinator for EAC, and so that is what I do. I'm over the Health Specialist, run the programs that we have for HIV testing and STD testing that we do in the community. And so I'm just one of the people in the background, but I'm also on the front line, so I do both sides. But I try to, get people out in the community to get tested and just kind of give more education over the STDs and, of course, HIV.
Awesome. So we know National HIV Testing Day is celebrated this month. Can you tell us what's the importance of days like National HIV Testing Day?
Well, it's very important because it gives the community opportunity to do free HIV testing in different Walgreens locations. So what we do is we set up at different Walgreens locations all over Arkansas. It doesn't matter. And then we, have a booth, we have tabling, we have different T-shirts on, National HIV testing, and we kind of let people know what's going on. Give them education over HIV, because some people want to do it, but it's more so like, oh, y'all testing for HIV, like, hold on, what am I getting myself into? And so we provide that education and kind of walk them through it of what it looks like, what it is doing, and what service we are giving to them.
Awesome. So let's talk about your perception of HIV testing over the years. How has their perception changed over the years that we've done HIV Testing Day?
Personally, for me, I didn't know the different testing that can be done for HIV. I thought it was just, a quick little blood draw and then go on about your day. But working for EAC has kind of opened my eyes of how far HIV testing has come and the education behind it as well. So it's kind of enlightened me in a sense to where I can also educate people and let them know, this is not a scary thing. Getting tested for it is just so important because it is what I call like a tricky disease, but it's not anything to be scared of. Once you get the education on it, it kind of changes your mindset on it too.
Yeah, and you've been spreading the education. So what has been some of the biggest misconceptions that you've heard about HIV testing?
Well, the biggest one is they think it's a death sentence. Like, oh, I test positive for HIV. People are gonna look at me like I'm dirty and stuff. I'm not clean. I'm somebody that doesn't take care of themselves. When in actuality, like HIV is so treatable and manageable, and you can still live a healthy and longer life. Like it's not the end. And so that's what a lot of people think when they hear that, if they come back with a positive result. And even if they don't get a positive result, they were nervous to even get a test because they're scared of the unknown. So that's where we come into play with the education part, and then kind of give them the reassurance that if something does come back positive or if something comes back negative, we're still in your corner. We're still going to support you and get you to the resources that you need.
Awesome. So maybe can you tell us some of the resources that you may give to folks, whether they're on the negative or positive side?
Yes. So, for instance, if someone has a negative status, we recommend, we reassure them and let them know this is what their result is. And then we provide safe sex kits, different brochures, giving them more education, and also letting them know that they can do a follow up appointment. So, we recommend, like, if there's someone that participates in common sex, or if they're participating in needle sharing or anything like that. And then we provide like resources for PrEP, so getting people sign up on PrEP, and that's kind of how that goes. So we just kind of keep them in line of, hey, do your follow-up testing. Let's get you referred to PrEP, and then here are other resources that we may not provide, but we can also link you to them as well. And then for someone who may have like a positive status, we offer like support groups they can come to so they can learn about other people that share the same status as them and kind of have that experience. And because it's life changing. So they're all over the place. They're not thinking clearly. So they think the world is over. They're, devastated. So we provide those support groups, any financial support resources that we know of, we help them with those. Testing, Ryan White programs, anything you can think of, we're going to link them to those resources.
Awesome. So let's talk about before the test. What should someone expect when they come for an HIV test?
Well, you can expect yourself to be nervous because it is, HIV is one of those things that people are just so, it's like a scary thing. Like, oh, I don't know what to do. If like my test comes back positive, I don't know what to do. But understand that the person that's testing you, they know and are learning more about HIV than what you may know a little bit about HIV, because the education is, again, so important, because that will change the mindset of someone that's getting an HIV test. So typically what I do is I kind of let them know the test we're going to do, because it's two different ones, and then reassure them, ask them like how they're feeling, ask them why they wanted to do an HIV test, because a lot of people, you have more people that are hesitant than they are like, no, I want to do this. Like, I want to, know about my status. I want to know where I am, like taking care of their health. And so we just kind of go through the motions and see where they are before the test is done.
Cool. That's great. You offer options and give them a little ease to their mind. So tell me this, how often should folks get an HIV test, or do you recommend, let me say?
So I recommend, if you, again, if you are someone that participates in condomless sex, if you are someone that participates in needle sharing, we recommend every 3 months, just because of like the incubation period and the window period. And then if not, then we just recommend like once a year.
So you mentioned that there are two types of tests that you all use. Can you tell us about the types of tests used by EAC?
So we have two different tests here at EAC for HIV testing. So number one, the easiest one is what I call it, is the HIV oral swab. It's by Orasure, the company that produces the oral swabs. And then the other one is by a company, ChemBio. They're testing, and that's a finger prick blood test. So both tests, you can get your results back in 15 to 20 minutes. So those are the ones we like to use. With ChemBio, it not only tests for HIV, but it also tests for syphilis. And so, what we recommend, if you have like a syphilis status, or you test reactive for syphilis, we recommend also doing an HIV test along with it. And so, ChemBio normally takes, it knocks two birds out with one stone. And then with oral swab, it just tests for HIV.
Okay. So you mentioned the incubation and window period. So that's still a thing. So
Yes,
can you
it
tell us
is.
about or explain what that is to the listeners?
Yeah, so basically, a window period is a term within the medical field, right? That is the time between the first infection and when a test can reliably detect the infection. So, say if you may have been possibly exposed, and you have a window period of the time from you possibly were exposed to when the infection will actually start to, you know, move around in your bloodstream. So, incubation period is when a host may be infectious than others. The presence of the infection has not yet caused the symptoms. And so we always tell people, like when they're getting tested, don't ever think that, you may not have an STD because it's not showing any symptoms. STDs are tricky there. It just depends on your body. We typically, for HIV, you have like a 3 to 12 week window period before symptoms start to show. So if someone is possibly exposed, we recommend that they get tested within those like sometimes 3 days to even 3 weeks, just to see where they are. And then sometimes when you do the test within that window period, you may get like a false negative or a false positive. So if a test comes back reactive, it may not necessarily mean from their preliminary test, which is what we use, it may not necessarily mean they are reactive for HIV. And so the next step would to be a confirmatory test, just to make sure like it's accurate. Window period is kind of tricky in a sense, like trying to see when the time period of when the infection was to when the test can accurately detect the infection. We also explain window period and incubation periods when we do our educational sessions too. So to kind of get a better understanding of like the infection you may have, and then the test may not accurately pick it up to kind of, alleviate the confusion.
Mm-hmm. Now, we know Arkansas is a predominantly rural state. So how does EAC reach out to those rural populations that may not have access to HIV testing, HIV resources, or anything like that?
Well, it's simple. Like we just get out into the community. We typically try to do our research first on what's within the community that may align with what we do as an organization. So we kind of go to rehab centers, colleges, different schools, transitional living spaces. We've even gotten into jails, which is crazy. I didn't see us getting that far, but we try to find different places where we know the community is not the best served. And so here at EAC, we don't, judge anyone for their background. We don't judge anybody because we always believe that everybody has a story. So what we just want to do is just help. We just want to serve people. We want to provide, free testing because the tests can be a lot expense wise. And so when people hear that we just do it for free, they're like, oh, okay, that alleviates a lot of stress. They don't have to worry about it, whether they have insurance or don't have insurance. We're just here to serve you. And we also dress like the community as well, too. So that makes it even better for people to approach us because we look like them.
Mm-hmm. Less stuffy and not in scrubs, walking around the community.
Now, we may have a little scrub on here and there, but we're trying to
most of the time not, right?
Yeah. But we're trying to put our logos on the scrubs as well. Like one of my specialists have like the logo on the scrubs, and so trying to be professional, but also, a little more lax.
Yeah, a little balance doesn't hurt.
A little balance, yes.
So let's talk about stigma. We know that days like National HIV Testing Day help to combat the stigma. What is the importance of talking about stigma in the community?
We have to acknowledge it. Stigma is the biggest reason why HIV testing is just so scary, because if you go back to when HIV was coming up in the world in the 80s, in the 90s, people were not, they don't want to test, they don't want to know. And so, because they know that they're going to be judged, people think of HIV as a gay disease. And so it's not that. Like HIV doesn't care if you are a black woman, a black man, a gay black woman, a gay black man, or a gay white man. It doesn't matter. It doesn't detect any of that. It just detects your blood. It detects your cells. It detects all of that. So debunking that stigma and letting people know, like, you're still going to be accepted. You're still going to live a long and healthy life. It changes that mindset within the community. It lets them know, like, there's a lot of different resources that are out here trying to get people to test for HIV. And then if you do have a positive status, you're not going to be left on the corner. You're not going to be left, behind, because there are also resources that can still help you and get you the medication that you need, pay for the medication you need. You have other you have other things that are stressing you out. We have financial resources. We have educational resources. We have housing. Like, it helps for so much. And so when you debunk the stigma, change the mindset, well, that spreads to other people. Word of mouth is powerful. So once they go through the experience, once they hear about all these different resources, they're going to share it with other people and get those people referred to us.
Mm-hmm. So, how can folks support their friends or family members who are going for an HIV test?
I would just simply say get tested with them. Show that they're not alone. I have a recent patient that we did. She called and wanted to come in to do a test with us, and she said I'll be bringing my friends and family. Well, not friends and family, but just like one friend was coming with them to support. And so I asked. I said, "Does your friend want to also get tested so you won't feel alone?" And they were up for it. You know, it made them feel better that a friend was also going through this with them and can kind of share the same experience with them as well.
That's good. That's support. So not only do they have you, but they also have like a friend as well. So that's some good things. Now, what advice would you have for someone who may be on the edge of getting tested, maybe afraid of getting tested, or maybe never gotten tested before?
I would say trust who you're with and who's testing you, and ask those questions before you actually do, the test. Ask your tester, like, give it to me straight. Like, I don't want any, beating around the bush. Like, let me know what I'm getting myself into. What can you offer me that's gonna, help me going through this testing experience? If I have a negative result, what's going to be the next steps? If I have a positive result, what is going to be the next steps? And advocate for yourself always, but ask those questions that typically providers won't, typically ask. Let them know what you're going through, why you want to do this, what brought you to do an HIV test, and just build that relationship with your tester, because they're only here to like help you out. They're not here to judge you. They're here to serve you. And just let them know like you're nervous. Help me feel comfortable in this moment, and just let me know that you have my back.
Love that. So, how can our listeners get involved in any kind of advocacy and support for HIV testing? You have like volunteers, or do you know of organizations that need volunteers?
Well, we do have a volunteer portal here at EAC, so you can always sign up and just go through our website, go to the tab where it says volunteering, and get signed up to volunteer with us. You can volunteer to be a driver with our Positive Miles transportation program. And that is a program that helps transport people that are living with HIV to their medical, dental, and vision appointments. So that's a really good way to get in the community, build rapport with those, kind of have an interaction. And then you can also volunteer with us at our testing events that we have. We're always going to a health fair. We're always going to a college. We're always going to a rehab reentry program. Like, we're always doing something. Or you can even just come in the office, chill with us, come to the support groups that we have. We always have something that volunteers can do.
That's cool. And there's an event coming up this month, or I know that there's an amazing showcase.
Yes. So we have the Epic Showcase happening on June 13th at 7 p.m. It is a fundraiser that is asking for donations to support our Positive Miles transportation program. You can sponsor a ride for anyone that is a person living with HIV. And it just kind of helps us support those that truly need it. Also, the money will not only help sponsor a person living with HIV, but can help us raise money to get another vehicle to our other locations in Southeast and Northwest Arkansas.
That's amazing. Amazing. So if you would like to donate, there's always time. And if you don't get to this podcast by the time the event happens, donations are always welcome.
Yes, donations are always asked for. We are asking for $25 donations. If you cannot do $25, because I understand where we are economy wise and everyone is, not able to provide 25, whatever you can donate is always accepted. So whether it be $1, $5, 10, whatever you choose in your heart to donate, then we'll accept it.
That's great. So let's talk about some of the maybe policy or the future. What are some of the changes that you would like to see in regards to public health and HIV?
I would love to see just more interaction with the community, doing more education over HIV, because that's the biggest thing. Like, we can want someone to test, but if you're not building relationships with people, if you're not providing the education that they truly need, then you're not going to get anywhere. Like, it's not going to change at all. Because of the education, because of building relationships and being out in the community and advocating for others, that's the reason why so much has changed with HIV. And that's probably why a lot more people are wanting to get tested for HIV, because they understand that this is not the end of the world. It's not the end for me. Like, we have people within EAC that like come to the support groups that are people living with HIV and aren't scared to share their story. They want others to know, like, yes, I am a person living with HIV, but this is what I do for a living. This is what I'm doing to give back to the community. This is what I'm doing to in preventative work. This is what I want people to learn, because I'm healthy. I'm living. I have children. I'm not dying or anything, and I'm making a positive impact on other people.
Mm-hmm. Now, earlier you mentioned researching the different areas that you go into. Now, tell me the importance of being intentional when it comes down to working in HIV, doing testing, outreach, or awareness. Why is it important to be intentional like that?
You have to be intentional within this field. You have to know what you want to get out of it as well. Like, I know for my intention, because I can only speak for me, I know for my intention I want to help people. I came into EAC not knowing a lot about HIV. I heard about it, I learned about it in school. That's pretty much it. I even did HIV testing as a routine exam when I go to my gynecologist. But you have to understand that it's bigger than that. People aren't in the same position as you are, and so when you get into this work, you have to understand, like, community is kind of difficult, but if you have pure intentions that I'm going to help this person, whether they get a life-changing status or not, like, if I help one person, then that means I did what I needed to do. That one person could let someone else know, and that one person could let someone else know that there are people out here that are willing to, provide free resources to make sure that my sexual health and well-being is where it needs to be. You have to be intentional on what you want to do. You have to be intentional on helping other people, because at the end of the day, no one else is really going to do it. But if you are motivating other people to get tested, if you're motivating people to come to different events that we have, if you're motivating them and getting them to see that it's not all that bad, then you're changing lives doing that.
Mm-hmm. Yeah, that sounds like your why. You sound like that's your passion behind it. That's great. So what keeps you going?
I would say, so doing certain events, I know that I am a young, Black woman. And so I know we are number one with the highest HIV cases. And so when I go to certain events, i.e. colleges for one, and I see other girls that look like me and seeing that relaxed, like, oh my God, like, she's actually out here doing this, because we have the stigma put on us that Black women can only be teachers, we can only be lawyers, we can only be nurses, And so once they see that I'm out here doing something that's out of the ordinary, and they're like, oh, how do I get into this? Because typically they're interested in the same thing, which is why they wanted to come and get tested. So when you build a relationship, you learn so much about people. But that's pretty much my why, like, just representing in a different way for us, and just making it easier for people to get tested. Like, representation matters so much. And I'm glad that EAC has, like, a very diverse employees within the organization, because everyone here has a story. And so us being in the community and us testing and providing that representation, it's amazing when you see someone that just, like, seeing you was really the reason why I wanted to get tested, or seeing you was the reason why I came to y'all's table, because, I don't see someone like me doing this for real. That's my why. Just being inspiration, representing myself and within EAC, and just letting people know, like, this is the thing that we can do.
You took the words right out of my mouth. The representation matters. So I love when there are stories and people talk about the importance of Black women in the conversation, because in the South, like you said, Black women have such a disproportionate diagnosis rate. So it's important that we do see Black women at the table, and doing, whatever it is that they want to do, whether it's testing or doing a speaking engagement, driving for positive miles, or whatever it is. It is important to see folks that look like the folks that we're serving. So we talked about some of the initiatives. Do you have like a list maybe of where y'all will be for National HIV Testing Day, or the cities?
Yes. So we are going to be all over Arkansas. So we have, from what I can remember, because I can't think on the top of my head, but I know we'll have locations in Conway. We'll be in Little Rock. We'll also be in Fayetteville, Magnolia, and I believe Jonesboro too. So we have 5 different locations we'll be at. So the team will be spread out. It's going to be a very busy day. I know we have 2 locations that are happening at the same time in Little Rock as well. So we're gonna be busy bees that day.
Yes, y'all are always busy going across the state. So where can the people find you or your team?
So you can find us on our website at www.engagingarkansas.org. You can go to our About page and see all of us on the team. Me personally, you can find me on LinkedIn, Angel Camper or Angel Camper. Social medias, I don't know if I can plug that, but my personals, it's the Angel. So on Instagram, Twitter, TikTok, all that stuff. If you want to build like a personal relationship with me, that is totally fine. There's no limit with me. I'm open. But yeah, that's where you can find us and the team.
Awesome. So yes, check out those resources. Look for those events that are coming up. Are there any other things that you'd like to promote? Any other events or initiatives?
I'll promote the Epic Showcase one more time. So it is June 13th at Clubs Way, downtown Little Rock area. And it will be, again, June 13th at 7 p.m. We really would appreciate if the community comes out. But if not, we will still love you the same.
That's great. So now, Angel, tell us, are there any parting words that you have for the listeners for this episode?
Yes, I just want to say I appreciate y'all listening in. I thank you, Eddie and Aaron, as well, for inviting me to come on EAC Speaks. I was like, oh, I got an invitation. I was excited. But continue to put yourself first. Continue to put your sexual health and well-being first. And don't be afraid to do an HIV test. Like I said, when you come to the website, you can sign up to do a free test and get involved with us. We are here for y'all. We are here to serve y'all, and we're here to love you.
You heard it here first. Put yourself first, and that includes your sexual health. Well, thank you again, Angel, for joining us on another episode of EAC Speaks.
Thank you so much for having me.
Yes, it was amazing. And thank you, listeners, for tuning in to another episode. We'll be back next month, maybe with some bonus episodes as well. So check us out on all of the socials for EAC. Check out our website. And again, if you would like to be a guest on EAC Speaks, please don't hesitate to reach out to us. We're always looking for new guests. Until next time, we'll say ciao.
Ciao.
The EAC Speaks podcast is partially supported by the Arkansas Department of Health through a grant funded in part by the CDC. All discussion is solely the responsibility of each participant and doesn't necessarily represent the official views of Engaging Arkansas Communities, the Arkansas Department of Health, CDC, or the U.S. government.